Yeah, hi guys. Good evening, one and all. Hope you're doing fine. Okay, chalo, let's start without wasting any time. Right, we are done with exam and hope most of you are waiting for the result to be out. And yeah, the result will be out in the next couple of days. We don't know the exact date, but at any point the result is going to come out. Okay, that is one important thing. Yeah, there are few things that we have to decide basing upon the rank or basing upon the marks. Point number one. And meanwhile, like whether you want to repeat the exam basing upon the result, because you have these two options in your mind, so that you need to check and take a call. But if you are planned to prepare or if you are ready to enter into MDS this year at any cost, there are few sector of people who are prepared to get MDS, whatever may be the result. Okay, if you get a very good rank, creamy rank, maybe you may be jumping into government dental college. If not, you will be jumping into a semi-government college or a private college or a deemed college. Like you may be mentally prepared. If you are planning to enter into MDS, okay, right? And as most of us are aware regarding that, it's a level of like you have different levels of counseling. There may be slight change in the pattern of counseling this year because Supreme Court has given a notification that they are going to remove the domicile for government dental colleges. Okay, and we need to wait for the notification to be out. As of now, we don't have any proper information regarding that. Probably once the results are out, they may take some couple of days to frame a new rules and regulations regarding that. But meanwhile, the pattern of counseling will be like this. You will be having the All India first, followed by the individual states are going to release their state counseling notifications. Okay, for individual states, again, you have to apply for the state council, state universities, the head university, and they are going to release a rank individually state-wise. And All India is going to be common, and All India includes both government dental colleges as well as the deemed colleges. Like all the deemed colleges, well-ever deemed colleges are a part of your All India. Okay, so All India counseling will be started first and followed by the state counseling. Probably All India round 2 will be synchronized with the state round 1. All India round 3 will be synchronized with the state round 2 and followed by the state round 3 will be done. The counseling number 1 is going to be a regular semi-government college seat, and the counseling 2 is going to be for the seats with more fees. Okay, simply A category and B category. A category seats are going to be less cost. So again, right, state is going to have 2 rounds of counseling. Okay, so first they start with A category. Once A category round 2 is done, they are going to announce about the B category counseling. So that includes both B category as well as C category. So this is a rough pattern of counseling. Probably if time permits, in the next couple of weeks, I'm going to prepare a nice sequence based what are the things to be addressed, what counselings and everything X, Y, Z. So that is a route map, okay, about the counseling, because I'm getting so many calls in the last couple of days, both from the parents as well as the students regarding all this. I'm just giving a framework. All India is going to start first, then the state notification will be out. You need to apply for your state colleges. Once state colleges you apply, they are going to release a merit list of the state. So basing upon that, state counseling is going to start. Again, some states are going to have 2 different counselings, that is A and B, A category and B category. So this is how it is going to happen every year. But that's what I'm telling. State counselings, there will be no modification. Okay, All India counseling, yeah, there may be modification basing upon the recent update of Supreme Court regarding removal of the domicile. Like you are an Indian, you are eligible to take government dental college seat anywhere. I don't know how they are going to set the rules and how the things are going to happen. We don't have any idea as of now. We need to wait for the exact notifications in which the rules and regulations and everything XYZ will be there. I hope this is very, very clear, because there were so many of you are asking regarding this. Okay, right? So you have colleges in Jammu and Kashmir, you have GDC Srinagar is there, GDC Jammu is there, okay, and you have colleges till Kerala. So every state, most of the states are having a decent number of seats. Okay, you roughly have around, like this year it has been increased according to the DCA recent update. It has been increased, so you have around like 850 to 900 odd MDS seats available in the entire country. That includes your AIIMS, PJ, JIPMER and everything. Okay, right? So for all these counselings, whether they're going to follow the old wala or whether they're going to implement the new thing that removing the domicile, you're an Indian, you're eligible to take seat anywhere, we need to wait for the notification, because these things will have some rules and regulations to be implemented, to be given by the government and implemented by the NBA through the counseling process. We need to wait and watch regarding this. Okay, so now you're prepared to enter into MDS. Okay, and like you have a span, right? So probably from the day of result to the counseling, probably third round. Okay, so most of us will wait nearly up to third round for the colleges and everything to start, and this may take 4 to 5 months, or sometimes it may take 5 to 6 months, more than 5 to 6 months of time. And the most important aspect for a dentist point of view, from a dentist point of view, from a student point of view, like because I have seen so many batches, and this is the 10th batch of mine, so I have seen so many batches. The most important phase, your entire phase, okay, right, from the date of your result to the date of the college where you are going to enter into the college, this particular phase, let it be 4 to 5 or 5 to 6 months, this is going to be very, very crucial in your entire life, because this is a space, or this is a time where you can think about yourself. Once you enter into MDS, the game plans are going to be different. Okay, so I'm not here to talk about what you're going to face in MDS, whether the college is going to be toxic, whether the patients are going to be toxic, or your co-PGs are going to be toxic. It varies. We don't have a static information that this place, this college, or this HOD, or this some XYZ is going to be toxic. Toxic is, it happens. Okay, it happens. Like a good HOD can be a bad in the next couple of months. Okay, bad can be good. A good senior can be a bad senior, or bad senior after a fight, or a good senior after a fight can be bad. Okay, so it is how you react to the situation. It is how you handle the situation. So my suggestion for all of you is, rather than worrying about being in a toxic area, being in a toxic state, or being in a toxic, surrounded by toxic people, okay, my point is, learn how to handle the situation. You need to learn how to handle the situation. So once you come into the world, and once you handle the situations well, okay, things will be cool and composed. Like, we don't know where we are going to get settled down until, like, everything is pre-planned. Like, I see most of the students who are live now are girls. Okay, so in Indian community, we don't know where the girl is going to get settled. Okay, so keeping all these things in mind, my kind suggestion for all of you, the young generation, is, okay, let's prepare and handle the situation. Okay, guys, all of you have given NEET MDS 2025, and all of you have crossed the phase of being difficulty. You are stressed, you are burnout, okay, you are frustrated, you cried, you have done lots of things. Okay, lots of drama was done in the last 2 to 3 months before the prep. I hope everyone has remembered those days. You are messaging me, you're texting me. This pattern I'm seeing from the past 10 years, and I'm a victim of this pattern. Even I have behaved in the same way. I'm not an exception for this. I'm a human. I also have emotions, and I came from a very low background family, and my rank is my hope to my family and everything. Today I'm standing in front of you doesn't mean that I have that privilege. Okay, by God's grace, or by students' grace, or some XYZ, okay, I'm here talking in front of you, and you guys are hearing me. There may be a day in the next 5 years or the next 6 years, okay, once you're done with MDS, you may be talking in front of a big crowd. So that's going to happen. So no one is exception for this. So my point is very, very clear. So you reach to this point working so hard. You know what you are, you know what you have crossed, you know what you have believed, and you are here. Okay, so once you enter into the college, again, there's a challenge, but guys, just trust me, you follow your basic ethics, you follow your basic principles. Let it be people around you, you may be toxic. Okay, you see, the world is toxic. Okay, world is toxic. When someone is doing good, there will be a sector of people who are going to question you, who are going to criticize you. Okay, so don't take criticism as toxism. Okay, that's what I'm telling you. People will criticize you. Okay, only criticism is going to make you perfect. That's what I believe. Like, someone is telling you, okay, you're not good at this phase. Let's take it in a positive way. Let's take it as a review and try to improve yourself. That is how it is going to be. Okay, but to handle all these things, let it be criticism or toxism, or you have a different things, right? So in India, you have a different things, highly populated. So you have more factors to be controlling you rather than you. Okay, so my point is, I want every one of you to become strong mentally, physically. So mental strength and physical strength, both. I recommend all of you, okay, who are keeping an ear to me from the past 1 year or 2 years. So I'm giving a golden suggestion for all the people who want to be successful in the life, who want to be successful in the next 3 years. That is the golden, I told you, right? Like golden hour. Okay, so like golden hour, you are going to enter into the golden phase of your life. So this golden phase is going to stand for 5 to 6 or 6 to 7 years. That's all. This is going to be the golden phase. And this golden phase is going to decide what you are going to be. What you are going to be to the society, what you are going to be to the family. If you waste this golden phase for XYZ reasons, like I see students are, my HOD is bad. It's okay. Your HOD or your co-PG or your senior or junior are going to stay with you for 3 years maximum or less than 3 years. For example, senior is there, so immediate senior is going to stay only for 2 years. Junior is there, you're going to stay with the junior for 2 years. HOD is there. If the HOD is not changing, you're going to stay only 3 years with the HOD. Point is very clear. There is high chances that the HOD can be changed. You cannot be changed. Okay, you cannot change, right? So you have opted a particular department in a particular college. So you are going to stay for 3 years pakka. Rest of the staff, they can move off. Seniors, juniors, everyone can move off. You cannot move off. So your place is more permanent than their place. So it is your ideology to behave in the way they require. That's what the problems comes, the ego clashes and everything, how they come. It is just by people are like, they have the ego issues, right? So how you handle the situation, how you handle the people is what it is determined. Okay, right? It's very simple. Like you need to handle the reception fellow will be there, right? You need to handle the reception fellow in a different way, and you need to handle a senior lecturer in a different way. Okay, what they want, what respect they are expecting from you, what benefits you have from them. Okay, so if you are in a right way handling the situation, handling the people, things will turn to your side. Okay, for this strongly I recommend you to have two important things. One is you should be physically strong and you should be mentally strong, because it's okay if you join a college or a department where the OP is less or the work is less, but if you are in a college where the OP is very heavy, you need to handle 5 to 6 cases per day. There are colleges where you need to handle 5 to 6 cases per day, and you don't have a chair set assistant in most of the colleges unless some intern is interested to help you. So for everything, for every simple, like you see the place where I have done PG, for even Gatapacha you need to move from the chair and you need to go ahead. For Selen you need to move, for LA you need to move. Okay, so this requires physical strength. Okay, so I strongly recommend all of you. Okay, I know most of you personally, so that is the reason I'm telling. So this 4 or 5 months, keep a challenge. Physically, I want you to, no need to go to gym and all these things. Like you can run, you can walk, you can do some yoga. Okay, you can do some yoga. Make yourself physically strong. Okay, so I want you guys to improve your stamina. Okay, like for the work. Okay, or you want to do something extra, because most of you are pinging me, sir, what apart from PG, what extra things I can do? Can I teach? Can I talk? Can I motivate? What can I do? Extra things. My goal is this, my goal is that. Yeah, very nice. For this, you require the physical strength. Okay, PG is not going to be easy. It's going to be a little bit hectic. Any department, it's going to be tough, because you are going to teach, you're going to take lectures, you're going to do seminars, thesis will be there, LD will be there, lots of things will be happening, patients will be there, everything you need to handle the situations. Okay, for this I want you to be physically strong. So for the next 4 or 5 months, do some activity, do some weight reduction programs. People who are overweighted, do some activity, run. If you want, you can join gym, you do some yoga. Okay, because all these things were done for you, right? In the offline center, ma'am has taken you for yoga. So activity is more important to me. Okay, that by which I want you to improve the physical strength. Second one is I want you to be mentally strong. Okay, mentally strong. Mentally strong means being positive. Okay, whatever may be the situation around you, I want you to think in a positive way. Okay, you to think, don't react immediately. That's what I'm telling. Like PG is going to hurt you if you react immediately. That's what problem is. Like if senior is giving you a suggestion or senior is scolding you for some XYZ reason, don't react immediately. That's what I'm telling. That is physical strength. Okay, that is mental strength. Okay, so mental, if you're strong, analyze the situation, talk accordingly. I see like most of the people, they throw. Okay, because young generation, if you just compare me to my present student, like a 10 years or a 15 years lab, I see people, our generation people at that time, okay, we don't react immediately. We take it, we think and we react. Okay, of course, everything has a line of limitation, or a threshold line is there. I accept that threshold line. I'm acceptable. Okay, but young generation, I'm giving you a golden suggestion. when you start your PG life, okay, let it be a teacher, or let it be a senior, or let it be a junior, or your co-PG, or a PGs from a different departments, don't react immediately, because that's going to disturb your integrity. Because what you carry for the next 3 years in a new college, or in the same college, in a new state, or in the same state, okay, is your integrity. You throw the things, you throw the words, okay, you throw all your short temper, frustration on the people around you. People will make you odd. You will be odd man out. So once you're odd man out, things will turn so worst. Your PG is going to turn so worst, because PG is something you cannot go out. It's not like a UG. I'm telling, like, it's not like a UG. Probably you'll be having an 18 PGs, or sometimes 9 PGs will be there. Okay, so you'll be very focused. Okay, PGs are going to be monitored very closely by the department people. It's not like UG. UG you have 100 people. First year 100, second year 100, third year 100, final year 100. So you should behave in a proper way, one, and you should not react immediately. That's what we always discuss, like type 4 hypersensitive, delayed hypersensitivity. PGs always require delayed hypersensitivities. So once you want to react, the first question that should hit your mind is, why I am here? Why you are here? Why you have joined PG? To learn. Your purpose of entering into a college, into a particular department, is to learn. That is the only purpose you are entering. Your purpose is to not to fight against the rules. Your purpose is to not to fight against the staff. Your purpose is not to fight against the students, fight against the patients. This is not your purpose. The purpose of entering into a PG is learning. Is doing as many number of cases, is getting as much knowledge as possible. Your hand skills should be improved, your talking skills should be improved. When someone is asking you to take a lecture, you should be the first one to react, because your talking skills, your crowd skills, you should stand in front of. I'm not, you check it out, like the first batch of MDS CONQUER, I'm very phobic to photographs, I'm very phobic to videographing. Okay, I don't talk. How I developed this is because of my PG. Talking with parents, talking with students, talking with patients. So everything plays an important role. Okay, someone is asking you to take a seminar, go, chalo, let's prove yourself. Everything, every day you need to take it as a challenge, and you need to move ahead, learn something. You're getting some reviews, you're getting some scores. Okay, someone is telling you this is right or this is wrong, don't take it as a criticism. Don't take it as someone is scolding you, someone is teaching you. Teacher will always teach you. Okay, I mean, I have seen the other side of the coin also, but my main concern of being a PG is learning every day on a daily basis, using the days properly. So you have 3 years into 3, somewhere around like 1000 working days will be there. You have 1000 odd working days, some 950 to 1000 odd working days, for which you are joining a private college, you are paying money. So every day you are paying, every day on a daily basis you are paying the college. So your purpose is to do n number of patients, as many patients as possible, learn as much as possible. You try to torture your teachers to teach something. That's what really required as a PG. Okay, you keep on asking them questions, keep on asking them, sir, please do teach this, please do teach that. That is how you should be. Okay, just imagine how you have started this journey. Just imagine what you are 3 months back. You suffered a lot to get a rank, right? You suffered a lot to get a rank, and once you get a rank, once you enter into college, you should not take anything granted. You should not take anything frustrated. You should suffer more the next 3 years to learn the hand skills. Suffering, right? So this suffering, like when you're doing patient, when you're getting the outcome, when you're delivering the results, that's going to give you more happiness as a dentist, because dental treatment outcomes the patient is going to appreciate immediately. Right? You see, I'm doing a smile designing. Patient is going to see the results immediately. Means the result is going to come immediately. We don't need to wait for a couple of months. Result is coming immediately. Patient is going to give you the positive vibes. Those vibes are going to give you the real enjoyment for your hard work. You do an extraction. Patient is going to come with a severe pain. Swelling is there. You do an extraction. Immediately there will be a relief to the patient. You give LA, patient will get settled down. So point is, being a PG, you should be mentally, physically strong. So mentally strong, I want you to work on few important aspects. Aspect number 1 is some sort of meditation. Meditation is basically self-control. Can you control yourself? That is my question. Okay. So in this media, you see like movies yesterday, a day before, 2 days, 3 days back, hit movie came. All violent, all hit movies. Okay, you see the biggest hit movies of Indian community are violence movies, right? So we love violence. Okay, so that violence is not going to work out in the PG. Okay, so how the PG should be is something like your 96 movie. I hope like most of the South Indians are familiar with the 96 movie. Okay, right? So it should be like a feel good. So PG should be feel good. Your presence should be feel good. Okay, so don't go for violence in PG. Okay, so my techniques, what you need to implement is, one is proper meditation. Okay, so you should be you should do the meditation. You should get that self control. Okay, maybe yoga may help you physically, mentally in touch. Okay, right? I'm not asking you to jump into spiritual world. Okay, maybe a spiritual world is one option to make you mentally more strong, but I don't suggest the youngsters to jump into the spiritual world. It is too early to jump into spiritual world, because I feel like you need to achieve there are many things that you need to achieve, because I myself, when I was entering into PG, I was so aggressive. Not people around me. I was aggressive about my goals. I'm always aggressive about my goals. Okay, so you have this aggression. So you try to convert all this aggressive energy towards your goals, what you want to achieve, for yourself, what you want to achieve for your family, what comforts you want to provide for your family, for your parents who has worked so hard to make you to be here. Okay, right? So those are my suggestions, and there are few other techniques which we will be discussing on a basis to improve this mental and physical health, which is more important to handle the situation. I see like most of the people are talking about situations. They're not talking about handling the situations. Okay, I feel like handling the situation is more important than talking and blaming about the situations. Okay, so please, it's a peak time that you have to open your eyes. You are no more, once you enter into MDS, you are no more an intern gathering a bunch of people, gossiping on others. Okay, so you need to I feel like you need to move ahead. Sometimes you may be the only person in the department to do a case, only person in the department to take a class, only person in the department to handle the patients, to handle the situation. So handling the situation is more important rather than blaming the situation. Okay, so that is my golden suggestion for all of you. Maybe we will be having few more sessions exclusively about department wise discussion. Okay, there is no good and bad departments. Okay, right? So every department is good according to me. It is your presence is going to change the outcome. Okay, let it be a perio, let it be an oral path and oral medicine, or let it be a community. Whatever department you do, whatever department you enter, it doesn't make any huge difference. Okay, right? What is going to make a huge difference is your presence is going to make a huge difference. Once you are involved in something, and once you give 100% with a nice mindset, okay, outcome, yeah, definitely I'll be always agreeing with you. The outcome is definitely the number of patients, which reciprocates the how much amount of money you are going to earn. That is the final meter for judgmenting the success in India. Right? Do you accept this? Okay, so in India, let it be your friends, let it be your relatives, everyone are going to judge basing upon how much you make. Okay, so that is the final outcome of every one of us. But PG should be started with a positive note. Okay, right? So maybe we'll have few more sessions. I'll try to get few more well settled, well behaved dentists, okay, in front of you. The main motto why I'm doing all this is we need a little bit of inspiration around us. Okay, so most of us are being influenced. We are being influenced to negativity. I feel that is what killing our mindset. Okay, so whatever happens in social media, okay, is limited to a particular individual. No need to get influenced. That's what I'm telling you. Don't get influenced by the social media.